Hello everyone, welcome to Pediatrics and Neonatology. This video is about hair loss, that is alopecia in children. Hair loss in children imposes great emotional stress on the child and the parent. Three diseases account for the most cases of hair loss in children: alopecia areata, Tinea capitis, and Trichotillomania. The first cause of hair loss in children is alopecia areata. Loss of every hair in a localized area is called alopecia areata. This is the most common cause of hair loss in children. An immunologic pathogenic mechanism is suspected because dense infiltration of lymphocytes precedes hair loss. 95% of the children with alopecia areata completely regrow their hair within 12 months, although as many as 40% may have a relapse in 5 to 6 years. A rare and unusual form of alopecia areata begins at the occiput, that is back of the head, and this proceeds along the hair margins to the frontal scalp. This variety is called ophiuchia, and this often eventuates in the total scalp hair loss, that is alopecia totalis. The prognosis for regrowth in ophiuchia is poor. Treatment of alopecia areata is difficult. Systemic corticosteroid given to suppress the inflammatory response will result in the hair growth, but the hair will fall out again when the drug is discontinued. Superpotent topical steroids, minoxidil and anthralin are the treatment options. In children with alopecia totalis, a wig is most helpful. Second important cause of hair loss in children is dermatophyte, that is fungal infection, which is Tinea capitis or ringworm infection. These include Trichophytum tonsurens in 90% of the cases and Microsporum canis in 10%. Dermatophytes become attached to the superficial layer of the epidermis and hair, where they proliferate. They grow mainly within the stratum corneum, that is the superficial layer of the epidermis, and do not invade the lower epidermis or the dermis. Release of toxins from the dermatophytes result in dermatitis. In epidemic ringworms, hairs are broken off at the surface of the scalp, leaving a black dot appearance. Pustule formation and a boggy, fluctuant mass on the scalp occur in these infections. This mass is called chorion. It represents an exaggerated host response to the organism. Diffuse scaling of the scalp may also be seen. Now, the treatment of dermatophytosis is quite simple. If hair is involved, oral griseofulvin is the treatment of choice. Topical antifungal agents do not enter hair in sufficient concentration to clear the infection, and the absorption of griseofulvin from the gastrointestinal tract is enhanced by a fatty meal. Thus, whole milk or ice cream taken with the medication increases the absorption. The dosage of griseofulvin is 20 mg per kilogram per day. With hair infections, culture should be done every 4 weeks, and treatment should be continued for 6 to 8 weeks following a negative culture. The side effects are few, and the drug has been used successfully in the newborn period. Now, itraconazole and terbinafine have been used when response to griseofulvin is unsatisfactory. Now, third cause of hair loss in children is trichotillomania. This is traumatic hair pulling. It causes the hair shafts to be broken off at different lengths, with an ill-defined area of hair loss, petechiae around the follicular openings, and a wrinkled hair shaft on the microscopic examination. This behavior may be merely a habit, an acute reaction to the severe stress, or a sign of a psychiatric disorder. Eyelashes and eyebrows rather than the scalp hair may be pulled out. If the behavior has a long history, psychiatric evaluation may be helpful. Oiling the hair to make it slippery is an aid to behavior modification. Okay friends, thanks for watching. Please like, share, comment and subscribe to my YouTube channel for more informative health related videos.